Definition. Cystinosis is a rare autosomal lysosome storage disorder caused by a defect in cystine transport. This poorly soluble amino acid accumulated in the lysosomes of various organs, especially kidneys, inducing progressive kidney failure. Patients often suffer cytopenia associated with cystine crystal in the bone marrow. This creates renal production of erythropoietin, hyperplasia, and myelofibrosis.
Here we have a specialized type of connective tissue known as bone. Bone can be very, very dense, or what they call cortical bone, which you see here as this pink band in the lower part of the field, or you can have a looser type of bone which goes by a wide variety of names, which we don't see here, but we'll get to later. In addition, bone has marrow. Bone marrow can be 100% fat, in which case it will not make hematopoietic cells, or bone marrow can be approximately half fat, like you see here, and half cellular, which is the normal general ratio for hematopoietic bone marrow. In adults, hematopoietic bone marrow is primarily limited to the axial skeleton, and the appendicular skeleton, the distal extremities, is primarily non-hematopoietic marrow, or 100% fat. Let's take a couple of clicks in here, and I think let's look at the marrow first. You can appreciate that approximately half of this cross-sectional area is washed out fat spaces or adipose tissue. You could see 1, 2, 3 arteries at least. You could see veins or venous spaces or sinusoids here, and here, and here, and here, and here. So
Application in medicine. The diagnostic is a maybe observing cystine crystal or by measuring the cystine content of the leukocyte. Although cystine crystals that are observed in the cornea on slit lamp examination or in the bone marrow and are diagnostic of cystinosis. They may be often in the patient younger than 1 year of age.
From an early childhood, I think probably before kindergarten, I knew I wanted to be a doctor that cared for children. As a pediatric ophthalmologist, I'm pragmatic, and my whole goal is reversing childhood visual impairment and preserving vision so a child can lead a normal life. Cystinosis is a rare disease caused by an abnormal accumulation of this amino acid called cystine. And cystine accumulates in all the cells and all the tissues and organs of patients who have cystinosis. And the main problem is that intracellular cystine increases so much in these cells that the cystine crystallizes. And it's these crystals that damage critical organs like the kidneys, the brain, and the eyes. The mainstay of treatment for cystinosis is an oral drug called cysteamine. And cysteamine reduces this intracellular cystine and significantly prolongs survival. Oral cysteamine can reduce crystals in other parts of the eye and the body because those parts have a good blood supply, and that's just not the case with the cornea. These crystals cause extremely debilitating symptoms like pain, vision loss, and horrible light sensitivity, to the point where some patients avoid the outdoors altogether or wear sunglasses inside. Our research is really two-pronged in its approach. The first research project involves the development of a sustained release form of topical cysteamine, and the goal of that project is to reduce the hourly application of this drop to once a day or possibly once a week. The second project is more long-term with a greater potential leap toward a cure for corneal cystinosis. And that project involves corneal stem cell transplantation. So we are using the mouse model developed by Dr. Stephanie Cherqui, and our aim is to transplant stem cells into the mouse cornea with the goal of blocking corneal cystinosis by replacing the diseased host corneal cells with healthy stem cells. Our preliminary results are promising, and we think that we are one step closer to a cure. My late father was a small-town pediatrician. The families in our community really relied on my father for many things, not only for medical knowledge, but for some support. And as a young child, I really saw firsthand how his work impacted children and families in our town. And it was through his work that I realized that the health and the well-being of children is totally directly linked to the health of a community. And I see that similar support in the cystinosis community. Patients who come and have a new diagnosis of cystinosis are really enveloped by this support by this community, and that's crucial. Being part of a cure for cystinosis is really personal for me because it really resonates with my desire to provide an unmet medical need for childhood visual impairment. But also, as a parent, I see that a cure would be incredible for these families. So much of why I am still a physician has to do with reaching out to patients who have no solutions. Our findings are very encouraging, and now more than ever, we do.
Pros and cons. This disease has no advantages. The contrary, the patient suffer many disadvantages from young because it is a genetic disease. Much have appropriate treatment for improve their quality of life. There are many foundations helping.
The Cystinosis Foundation educates families and patients and medical professionals about cystinosis. It is an ongoing mission that we have extended internationally. On a biannual basis, we host educational conferences for medical professionals and families. This summer, July 24th through 26th, the Cystinosis Foundation is collaborating with the Cystinosis Foundation of the United Kingdom to host the 8th International Congress in Manchester in the United Kingdom. The two additional functions of our organization is supporting the Cure Cystinosis International Registry, which was established in 2010. You can visit the website at cystinosisregistry.org. We encourage every patient to register. This helps medical professionals understand more about this ultra-rare disease. An important aspect of our mission is mentoring the establishment of support groups around the world. Removing the severe, lonely aspect of coping with an ultra-rare disease is very important, and establishing support groups in different nations has helped remove those feelings of isolation.
Ensure applied in Ecuador. There are no cases of this disease in the database, but in the other countries like Venezuela, Mexico, and Brazil, if there are several cases.
I think the most important thing about childhood is just having opportunities to explore, to have fun, to interact with family, to learn about nature. So important to be inspired by those around us who have lived longer than us, that have experiences, that have history and stories. Really, it's family, it's love, it's time together. It's the most important thing in life.
Cystinosis is a disease that affects every cell in the body. And what happens is our cells use amino acids. One of them is called cystine. And after your cell's done using cystine, normally it's transported out in kind of like waste at that time. It just goes out of your system. In people with cystinosis, it can't get out. It doesn't have a way to get out of the cell. So what happens is it sits there, it crystallizes, and it builds up and essentially kills the cells off. So every organ's affected.
And Gabby has told me, like, I have sand in my eyes. And so photophobia is another symptom of cystinosis. But that's hard. It's hard to hear that she thinks she has sand in her eyes when I know that it's really crystals forming in her eyes.
It's a terminal disease that is kind of eating away at you from the inside out. Kidneys are the first ones affected, and then it just continues on.
I think it's hard that we have to wake her up or interrupt her day to give her medication to keep her alive. I'm also concerned about the muscle wasting issues. I just want her to have the best life possible and to be surrounded by people who love her despite what she has to deal with. I just want the very best for her, and I just don't want her to have to slow down or stop doing anything she would want to do because of cystinosis.
If you focus on your child's personality and how they're being, and just focus on the good part all the time, try and stay focused on the good part, because the one good thing is that, you know, when Gabby's running around, she is happy. She's always happy. She's content, and, you know, we don't have to look at the disease every day. You know, you can choose to do that, I think, but you as a parent don't have to.
Disease community is small, but it's supportive, and we have foundations like the Cystinosis Research Foundation that are working so hard every day, and doctors and researchers are in their labs every day, fighting for our kids and giving us hope.
I mean, the stem cell stuff that Dr. Shirky's doing is awesome, groundbreaking work that is going to have effects on more than just cystinosis, right? It's actually going to affect every disease to a certain extent, because she's figured out an innovative way to fix what's broken. And I mean, that impacts tons of diseases.
Don't fear, there's going to be a cure, and we just got to keep doing what we're doing, and fundraising, and just keeping our chin up, and looking to the future, and knowing that it's going to be bright, and there's hope for our kids and for our families.
Conclusion. The cystinosis crystal in bone marrow. It is a lysosoma storage disorder rare, autosoma caused by a defect in the transport system which is located in the bone marrow. It can be hereditary. The diagnosis is maybe observing cystine crystal or by measuring the cystine content of leukocyte. Although cystine crystals that are observed in the cornea still lung examination or in the bone marrow are diagnosis of cystinosis. The diagnostic patient will have a simple weather balance. There is a foundation that helps patient with his pathology.
I'm Katie. We're from Canada. My hope for Abby is to live a full life, a happy life. We do wish for a cure, of course. We have to bring a lot of stuff with us when we travel. A lot of medications, a lot of things to just make her feel comfortable. While we were here, Abby was sick yesterday, actually, so we had to go to the walk-in clinic, so that's an extra challenge, explaining to them what cystinosis is. It's super, super encouraging just to see where they're at, and even to meet some of the older patients with cystinosis and see what they're doing. It's very encouraging. Abby today was just excited to play with her friends again that do the same things as her and take the same medications because she doesn't have that at home. So yeah, it's really uplifting being here.